Fracture. We will start this section by the definition of the fracture. Then we will classify the fracture according to the etiology, breaking pattern, complexity, displacement, external environment, and force. Then we will study about the healing mechanism in the fracture and some of the factors that affect during the healing mechanism of the fracture. Then we will classify the treatment modality into 3 phases: during the traumatic care, emergency care, and the definitive care, and at last the rehabilitation stage. And we will conclude this lecture by studying about the complication under the heading of the immediate, early, and late complication. So the fracture is defined as the breach in the continuity of the structural continuity of the brain of the bone. Means there is a break in the structural continuity of the bone. So this is the definition of the fracture. Now we will classify, and to remember the classification on what heading we are going to classify, it can be remembered as A, B, C, D, E, and F. A is for the etiological classification, and under etiological classification the fracture can either be traumatic or it can be pathological. If there is any underlying bone disease which caused fracture, then that is considered as pathological type, and if the fracture is due to trauma, then that is traumatic. Now according to the breaking pattern, one should know that this can be either transverse if the fracture is in perpendicular direction to the longitudinal axis of the bone, then that is considered as transverse fracture. If the fracture line is obliquely, then that is called as oblique type of fracture. And if the fracture line is spiral in shape, means usually the spiral is in this shape, it is considered as S-shaped fracture. So this will be considered as a spiral type of fracture. Comminuted means when the fracture is has caused break in the bony parts, means there are multiple fragments of the bone present, then that is considered as comminuted type of fracture. And the last is the segmental type of fracture. Segmental means there is two fracture line present in the bone, and this is considered as the segmental type. So according to the breaking pattern, it can be transverse, it can be oblique, or spiral. The fourth is the comminuted type, in which there is multiple fragment, and the fifth is can be either segmental type. So this was according to the breaking pattern. According to the complexity, the fracture is divided into simple if there is no involvement of any vital organ or nerve or vessel, then that is considered as simple type of fracture. And if there is involvement of any nerve, vessel, or vital organ is present, then that is considered as complex type of fracture. Now according to the displacement of the joint, the fracture can be either undisplaced or displaced type of fracture. Undisplaced or displaced. According to the displacement, E represents the external environment, and if the fracture is communicating with the external environment, then that is considered as open type of fracture. Means there is communication with the external environment, whereas if there is no communication with the external environment, it is considered as closed type of fracture. And open type of fracture is also called as compound fracture. compound or closed type according to the communication with the external environment. And the fracture can also be classified with the force involved in the force of injury. So this can be high velocity injury or low velocity injury. Low velocity injury or high velocity injury. So these were the 6 classification modality for classifying different types of fracture. There is one more classification pattern that can be according to the involvement of the bone. So if the whole part of the bone is involved, then that is called as complete type of fracture. And if only a partial layer of the bone is involved, then that is incomplete type. So these were the 7 types of modality for classification of the fracture. Now we will look for the healing pattern in the fracture. So all the healing stages can be remembered as had grown a cow like model. So these are the stages of healing in fracture. So what is this? The first stage is hematoma formation. After the formation of hematoma, then there will be inflammatory stage. Inflammatory stage starts from acute inflammation, and acute inflammation as we know that a neutrophil comes in action, and then D represents the demolition phase, and demolition phase is the chronic inflammatory process. So these are the means after hematoma there is inflammatory stage that starts from the acute inflammation and proceed to demolition phase, which is the chronic inflammatory stage. Then this is for the head, means hematoma, acute inflammation and demolition. Now we will come to the Z for the groin, means Z is the granulation stage, and after Z we have C, means C is the callus formation. And this L is nothing, it is just to complete the sentence, means had grown cow like a model. And as we saw that the C is the callus formation and model is the remodeling stage. Earlier the remodeling stage was known as the stage of consolidation. We should know that the remodeling stage was earlier known as stage of consolidation. And after remodeling stage there is modeling stage. This remodeling stage is usually very large duration of about 1 to 4 years, and the immature bone is converted into mature bone in this stage. Then at last for the modeling stage, this is the stage in which the bone comes to its original shape. So how we remember the healing stage? Healing stage can be remembered as had grown cow like a model. Had represents the hematoma formation, acute inflammation, demolition stage, which is the chronic inflammation. Now Z is for the granulation reaction, and C is for the callus formation, which is non-ossified woven type of bone formation, that is immature type of bone formation, which is usually seen in between the fracture site and which connects the two bone end. Now after the callus formation there is model, means starts from remodeling stage and finally goes to the modeling stage. This was the healing mechanism. One should also know that some of what are the factors that influence the fracture healing. So the first factor is the age. As we know that the child can heal very fast, almost half time is usually required for a child to recover from a fracture than the adult. Now, what type of bone is involved, that also influences the healing. Usually the flat bone takes very less time in compared to the tubular or cortical bone. Then location of the bone also influences. Location में क्या होता है, usually the diphyseal fracture and metaphyseal fracture has a variable healing period. And if there is any systemic disease present in the patient, like diabetes mellitus, it can be any other hypertension, means these are the disease which usually prolongs the duration of the healing. Now the other factor can be pattern of fracture. Pattern में क्या होता है, this is very important MCQ point that can be remembered as SO and T, means the spiral type of the fracture takes the least time, than the oblique type and then the transverse type. Now if there is any soft tissue involvement, any other injury to the vessel or nerve is present, then the fracture will take large time. And during treatment modality, if the reduction is not appropriate, रिडक्शन में कोई प्रॉब्लम हो गया और inappropriate reduction is done, then that will also prolong the healing mechanism. If the immobilization is not sufficient, then that can also affect the healing stage. And if there is compression at the fracture site due to use of any hard compressive type of cast, compression. So these are some of the factors which influences the healing of the fracture. Now we will look for the treatment modality of the fracture, which is divided into 3 phases. The first phase is the first phase starts as a emergency care. First phase is for the emergency care, and usually it is done at the site of the accident or emergency room. This is emergency care. Then the second is the definitive care. Second phase में क्या होता है, it is definitive care. And the last is third phase is the rehabilitative care. Starting from the emergency care at the site of the accident, usually the first priority is to resuscitate the patient by looking for the airway, breathing, circulation and deformity, and at last we will exposure should be done to look for the further injury in the patient. After the resuscitation is done in that patient, our first responsibility in case of fracture is to can be remembered as RICE. R is the rest to the fracture site, rest to fracture site. Okay, either by splinting by any mechanism with folded newspaper or cardboard or wooden plank. By any means you have to splint the fracture site. Okay, now I is for the ice application. Ice application is done to reduce the swelling. Swelling के लिए we should always search for the ice. And C is the compression with crepe bandage to reduce the swelling. C is compression. And E is the elevation of leg of the injured limb above the level of the heart to reduce the swelling, or by using pillow if lower limb. And sling and pillow can be used in case of upper limb. Elevation of the limb should be done. So these were the emergency care. Under emergency care, first of all resuscitate the patient by securing ABCDE, and then perform RICE, means that is provide rest to the injured site or fractured site by the splint, and apply ice to reduce the swelling, and compression should be done to reduce the swelling, and elevation of the limb should also be done to reduce the swelling. Now we will come to the definitive care. And usually definitive care is constitute of three components, that is reduction, immobilization, and prevention of function of the limb, RIP. So these are the three modalities or the component in the definitive care. So starting from the reduction can be done in two mechanisms. Either it can be closed reduction or open reduction. So reduction, under closed reduction, either we can manipulate manually, or there can be continuous traction can be given. Okay, under closed reduction, we should know that we can manipulate manually under general anesthesia, or the other modality can be continuous traction can be applied for the reduction. Now the other reduction can be open type of reduction, and open reduction can be done by surgically exposing the fractured site and manipulating with the external or internal fixator. Means if we are manipulating the fracture site by exposing the fracture site, then that is open type of reduction. Now a very important component in the definitive care is for the immobilization. में क्या होता है, immobilization में what are the modalities by which can be applied for immobilization. Okay, so some of the modalities, usually there are 5 modalities that is helpful in case of immobilization. We can simply strapping can be done in the site of the fracture. Strapping means strapping of the surrounding, or the suppose that this finger is fractured, then we can strap this fractured finger with the adjacent bone or the other finger. Okay, so this was for strapping. The other modality can be sling, means triangular sling. You might have seen being applied in case of the cervical this clavicular fracture. So sling can be applied. The other modality can be cast immobilization, and as we know that the cast is usually made up of plastic of Paris, which is CaSO4 and half H2O, and after exothermic reaction this half H2O is converted into 2H2O after exothermic reaction. This exothermic reaction is very important in case of MCQ. So and usually this plaster of Paris it can be applied as a cast or a slab. And what is the difference in this both? Cast is usually covers the whole circumference of the limb, whereas the slab covers only a part of the limb. So this is the difference between cast and slab. The other modalities can be either continuous traction can be continuous traction. Continuous traction is usually applied in the part of the limb distal to which the site to exert longitudinal pull and counteract the redisposing force. Usually the continuous traction can be applied with the help of gravity, or it can be skin traction or skeletal traction. This continuous traction can be applied either traction by the gravity or skin traction, or it can be skeletal traction. And the difference between skin and skeletal traction is this skin traction is usually performed in the child, whereas the skeletal is performed in the adult. The skeletal traction can exert a high amount of weight, means more than 5 kg of the weight can be beared with skeletal traction, whereas skin traction bears less than 5 kg of weight. And these are skin traction is usually temporary type, whereas skeletal traction has a longer duration. And the fifth type of immobilization is operative method. That can be ऑपरेटिव मेथड में क्या किया जा सकता है? सो अंडर ऑपरेटिव मेजर फॉर इमोबिलाइजेशन वी कैन परफॉर्म एक्सटर्नल फिक्सेशन और इंटरनल फिक्सेशन. अंडर एक्सटर्नल फिक्सेशन वी कैन यूज पिन फिक्सेटर और रिंग फिक्सेटर्स. But in internal manipulation or internal fixation we can use screw, nail, plate. So these are the some of the modalities, or any combination of screw or plate, screw or nails. So these were the internal fixation modalities. So as we saw that and P, the last component in the definitive care is for the P, and P is the prevention of the limb mobilization. So this can be done with the help of the physiotherapy, prevention of the function of limb, prevention of function of limb. So this prevention can be done with the early initiation of the physiotherapy. Okay. So we studied about the emergency care, in which we studied that resuscitation should be performed at first. So we should look for the A, B, C, D, E component. Then we saw the RICE component, that is rest, ice, compression and elevation of the limb to prevent the swelling and immobilize to the fracture side. Then in the definitive care, we saw that there were three components, that is RIP, means reduction, immobilization and prevention of the function of limb. For reduction we can perform either closed reduction or open reduction. Immobilization has 6 components, that is strapping, sling application, cast or slab, continuous traction, and at last we can go for operative measure, that can be either external fixator or internal fixation. And for the prevention of the function of limb, physiotherapy can be done. And the last component in the treatment modality is the rehabilitation, and it is very simple. Early movement should be initiated and gait training should be done, gait training, exercise of the limb and early movement of the limb. These are the 3 component in the rehabilitation. So to remember all these 3 at once, we need to remember RICE, RIP and ZEM. ZEM is for the gait training, E is for the exercise, early exercise and early movement. So these were the 3 modalities or the 3 components during the rehabilitation stage in the treatment of the fracture. Now we will thoroughly look at the complication of the fracture at last. Complication of the fracture can be divided into three types, that is either immediately during the fracture or early complication, or it can be late complication. And every three of these types has either local or systemic component. Suppose that immediately during the fracture, at the site of the fracture site, there can be injury, whereas the systemic response to that injury can be hypovolemic shock. How should we remember this? First is the immediate type, another is the early, and at last is the late. And all the these three component has local as well as systemic complication. So immediately during the fracture, there can be locally injury to the viscera, vessel, nerve, and systemic response can be hypovolemic shock. Now we will look for the early complication. And how can we remember this? Immediate is I and S, injury and shock. IS, IC. IS, IC is safe. So this is the method to remember the complication. ISIC, this is not ISIS, so this is safe too. Okay. Now IC is for the infection at the site of the fracture, and C is the compartment syndrome. Now safe, for the safe, this is a septic arthritis. S is for septic arthritis. This and H is hypovolemic shock. ARDS, as well as there can be it can also cause aseptic traumatic fever, and F is for the fat embolism, and E is also embolism, but this is pulmonary embolism, usually due to deep vein thrombosis. So how did we remember immediate? IS, IC is safe. Now the last component is the late complication, and late complication can be remembered as union of Miss Asia. So union, there can be any union abnormality, means during the union of the two bone there can be abnormalities like delayed union, which is usually when the union of the fracture is takes more than 6 months, and if there is malalignment in the union of the fracture, then that is called as malunion. There can be delayed union, malunion, or non-union. And if the fracture union is not between the two respective bone but to the opposite side of the bone, means if the radius joins with the ulna and ulna joins with the radius, then that is called as cross union. So this is the local complication, late local complication, and last is the late local or systemic complication. This Miss Asia is usually it can be either local or can be considered as local or systemic type. So M is the myositis ossificans. Myositis ossificans. I is for the ischemic contraction. Ischemic contraction. S is the stiffness in the joint. Stiffness in the joint, and other S is the shortening of joint. A is the avascular necrosis. This is Sudeck osteodystrophy. I is the ischemic contracture. This is usually the result of the ischemia in the ischemia during the fracture. Ischemic contracture. It can also cause infection and inflammation. Means ischemic contracture is already there, then there can be inflammation of the or infection in the joint. And A is the arthritis, means inflammation. So this was the mechanism of the so we remembered it as ISIC is safe where in union of the mesacia. So this is the method to remember all the fracture. Thank you.